Breast augmentation, or commonly known as breast size increase, is a process which is done to increase the size of the breast for the patients who have underdeveloped breast. So they don't have self-confidence because of underdevelopment of breasts. So this breast augmentation or size increase is done by the help of implant, silicone implant. Silicone is inert material which is used in other procedures also, like in brain surgery and heart surgery. Silicone is inert material, so it is not harmful to the body. It doesn't react with the body. It is inert material. So when it is inserted inside the breast, it doesn't react with the breast tissue, or it doesn't hamper with the breast tissue at all. It remains there like a inert material, so it doesn't hamper the breast tissue, and it is not harmful to the body. So there are myths about the silicone implant that it is harmful for the body. It's not harmful at all, and the procedure takes around only 1 hour, 1 to 1.5 hours, and it's a daycare procedure. Means you get the procedure done in the morning, you can go back the same evening, and it enhances the self-confidence, self-esteem, and the procedure, although daycare, but you have to take certain precautions for few days or few weeks, depending upon the whatever is your present size and how much size increase do you want. So depending on that, for how many days you have to take precaution, like avoid gymming, so that we tell the patient as it varies patient to patient, so we cannot fix it up. So it is like we, according to the patient, we tell the patient for this much time you have to avoid gymming or some hard work. Otherwise, a normal routine activity can be started with the very next day. So it's a daycare procedure. And the other thing which has come for a few years now, the patients who do not want augmentation with silicone implant, they don't want any foreign body inside the body. For those patients, the other option is fat injection. So what is done in fat injection? We take fat from the unwanted area, like somebody having unwanted fat on the stomach, we take out the fat from there, and we do lipo injection or fat injection in the breast. So this is means दो पंथ एक काज, दो चीजें एक साथ हो जाती हैं. Your fat is reduced from the stomach and your breast will be enhanced. So we can do body sculpting by that. So this body sculpting helps a lot in increasing the self-confidence of the patient. So there are two methods, one is with silicone implant and other one is fat injection. The difference is that with silicone implant, with whatever size you want can be done. Not whatever, there are certain limitations, but yes, it is very much near to the desired size of the patient. But with fat injection, in one go we can increase 1/2 inch or 2 inch, and with implant we can increase much more. So with fat injection, maybe if person wants size increase which is not feasible with fat injection in one go, then patient has to take 2 sessions of fat injection. With implant it can be done in 1 session only. Breast reduction or reduction mammoplasty is a process which is done for patients who have very heavy breast, heavy drooping breast. So because of this heavy breast, there is not only aesthetic deformity, but because of heavy breast and droopy breast, there are physical discomforts also, like shoulder rashes, brazier strap rashes, and difficulty in walking. Some patients they have 40E cup size and 40D and breasts hanging up till the navel. So with such heavy breasts, there are a lot of physical restraints are there. So for correcting that, the process is called the reduction mammoplasty. This process takes around 2.5 to 3 hours, and in this the breast tissue which is hanging down at the lower pole is removed, and the breast is toned up and tightened up. And if nipple areolar complex is hanging, then that is also fixed up. So overall the breast size is reduced, and also simultaneously the breast is tightened up. So this process which takes around 2.5 to 3 hours is a daycare process. we have to check other parameters like thyroid, other things. We get the total profile done. If there is any other concomitant problem or any other medical problem is there, then we ask the patient to stay back. Otherwise, as a procedure, this is a daycare procedure, and after the procedure patient can start the routine activity after 2 days. And patient has to take certain precautions like avoid lifting heavy weight for around 3 weeks, avoid swimming and heavy weight lifting in gym for around 6 weeks. So these precautions are there, but this procedure is really very rewarding, because somebody having, you can imagine, 40D size or 40E size is reduced to 32 or 34B or C cup size, then the whole structure of the body is reduced from large or extra large to small or medium. So the whole body frame is reduced, so patient's self-confidence is also boosted up, and the physical burden which was there on the chest is also removed now, and then patient feels very happy, and this is very common procedure nowadays.